Hi, I'm Mandy back with another video, and I'm going to talk about the role of anxiety in parents and how this may affect your child. A few days back, I started to post a series about values and how to teach your children values. And I kind of went down a rabbit hole with the other videos. And the next one I made after that was if you're struggling with attention issues or inattention and a different type of hyperactivity issues, how you might come across to your child and things to be mindful of when you're parenting. Then I realized, well, I should probably talk about anxiety because this is a really common one for parents or potential parents. So I was watching a YouTube video the other day, and it was Maya Bialik from Big Bang Theory. And I don't know if anybody follows her, but she just kind of came up on my feed, so I watched it. And she said things that I wish I would have known before becoming a parent, or it's something like she wanted to have 11 children and then realized after 2 that was probably all she was going to have. And the reason why was because of the high stress and the high demand that kids are. And so I really would encourage you to watch that video if you really sort of have a starry-eyed vision of what it might be like to raise a child, because I think she was very honest and very clear about the types of time and attention that newborns to infants to toddlers really require. And I get this all the time in treatment where adults come in and they're, think that they can keep up their same lifestyle pace generally, and then they have children and they start to wonder what happened, and anxiety goes up. So let me start to talk about anxiety. So I'm going to break this up into 3 groups. People who are not yet parents, we're going to talk about that group and anxiety. We're going to talk about people who are parents who do not have a child diagnosed with an autism spectrum disorder. And then I'm going to talk about parents who do have a child or multiple children diagnosed with an autism spectrum disorder and that type of anxiety. That will be a lot of content that I'll be putting out over the next few months, because this is really a big theme of the book that I'm writing. So let's talk about development first. And I like Piaget. I don't know if you know who he is. He's a theorist, he was a psychologist, I believe, in the early part of the 1900s. And his theory really wasn't, it's very simplistic if you really just kind of look at the foundational part of it, but it's so meaningful for so many things, and I always integrate it in my work when I explain these types of things to parents. So the first stage that Piaget says that we go through as babies, as infants, toddlers, and he has sort of, age ranges on these, but it's relative. It's not, set in stone that these are the exact ages. It's approximate. So his first stage is birth to 3, and that's sensory motor phase. And really what I want to convey to you about that phase and how this approaches your anxiety as a parent is that kids at this age are learning everything through their environment. They're learning everything through their senses. Okay, these are kids who are not diagnosed with autism spectrum disorders. Yes, they are too, but neurologically we kind of branch off and there might be some differences. So let me stick to kids who are not diagnosed with spectrum disorders, or not, in hindsight, if you're a parent who may not, who maybe have had the diagnosis, but of course you didn't recognize it that early. So this group of kids is learning everything from their surroundings. They're learning how to navigate life through their primal brain, right? And fight, flight, and freeze. How to get their needs met through their senses, through crying, through their responses. And this is where ABA starts to come in, where their behavior conditions a response. So cry to get food, cry to get comfort, those types of things. The important thing to remember during this phase is because the kids are so sensory driven and they're navigating all of their life through that, they can pick up on lots of things. One, your feelings and your mood. And again, that's wired in the primal brain. I talk a lot about polyvagal theory in my other videos, but it's hardwired for them at this stage to really pick up on your mood. So it's very important, I will say to you, parents who do not have kids yet, or wishful parents, parents who have kids and who have kids with diagnosed with spectrum disorders, at this phase in your child's development, they're really able to feel your mood. So I would strongly emphasize that you reflect on that. And I guess there's more to come because I'm almost at 5 minutes and I like to keep these short. So I will be doing a part 2, and then I will break the parent groups down into 3 and talk specifically. So that was the foundation about child development and then being able to feel your feelings.